Okay, thank you everyone for attending our press conference this evening. We're looking forward to sharing some comments with you from some of our elected officials and some of our other city department heads. So we'll get started here right away. First person I'd like to bring up is Mayor Robert Garcia, City of Long Beach.
Well, thank you all for being here today. We of course, here at Long Beach want to ensure that we're providing everyone in the community across the county and the region with accurate information as it relates to COVID-19, or as a lot of folks know it, referred to as the coronavirus. The City of Long Beach today is releasing that we have 3 confirmed presumptive cases of COVID-19, which is of course pending final confirmation from the CDC. It's important for people to know that while those tests have come back as positive, it's not until the CDC confirms those cases that they become official through the CDC confirmation process. But they have all 3 tested positive. We understand that this is certainly unsettling for our community here in Long Beach, but please know that we are doing everything that we can to ensure public safety, that we're reviewing all the information that we're gathering from our partners, and of course, coordinating with all of our medical personnel here across the city as well as the county. Our health department is currently right now assessing and going through an extensive investigation to identify and minimize the spread associated with these cases and of course others that may arise in the future. We have been preparing for this for many months and weeks. We just held a briefing not too long ago to ensure people that they knew what was happening across the city. And we just, of course, recently also declared a state of emergency here in Long Beach, coinciding with the state of emergency of both the state of California and our regional and local partners. Now, it's important to note that Long Beach is preparing aggressively, and also that we understand that this is a very serious global health public crisis, and that we are taking it with extreme caution and seriousness. Long Beach residents across the city and of course all of our partners in the region and the county need to stay informed. We also want to note that the city is in constant communication with our partners. This of course is the CDC, the California Department of Public Health, LA County Health Department, our hospitals, of course, who are dealing with the crisis, our urgent care centers, and our local providers that are directly working with people across the city. I also just want to note that we have a very important relationship and communication effort with our public school system, the Long Beach Unified School District, our community college, and of course Cal State Long Beach. You may have read today or seen reported that 10 students and 2 staff members from Cal State Long Beach have self-quarantined. That was reported today. That is the case, as we're all aware. Those are not related to the 3 cases that we are discussing here tonight. I want to note that the city is being incredibly proactive as it relates to COVID-19. The Long Beach Airport is undergoing extensive cleaning and extra disinfecting of public spaces. We're making sure that hand sanitizers at all of our public facilities are clean and that we're providing them. We're working with our major employers across the city. And of course, the port is a big partner working with our federal partners as well. I will reiterate, since we've been asked, that once again, ships coming in from China are not being disembarked. And so workers on those ships are staying on their ships and they are not disembarking into the city, both here in Long Beach as well as in Los Angeles. All of these steps are aggressive, but they're appropriate given the situation. And I want to remind folks, before I turn this over to Dr. Davis, that it is very important that you wash your hands with soap and water for at least 20 seconds, that you're avoiding touching your eyes, nose, or mouth with unwashed hands. And if you are at home, if you're sick, to please stay home. If you are sick, please stay home, and we're actually even encouraging folks, if you can, give folks a fist bump if you really feel you need to shake someone's hand. It's a much safer way right now. And so I'd like to turn this over to Dr. Davis to get us more information about the 3 confirmed or the 3 positive cases that we have. I'll turn this over to her.
Thank you, Mayor Garcia. So now that we have, I'm Anissa Davis, I'm the City Health Officer for the Long Beach Department of Health and Human Services in the City of Long Beach. So now that we have 3 presumptive positive cases, we're conducting extensive contact tracing to determine who else may have come in contact with these individuals, as well as identifying the potential sources of the infection in these cases. The cases are considered presumptive until the Centers for Disease Control and Prevention has confirmed the results. 2 of the cases recently returned from a cruise ship on the Nile River in Egypt, where other cases of COVID-19 had been reported on the ship. 1 patient had traveled to an area with known community transmission in Northern California. In response to these cases, we are actively tracing the whereabouts of the patients while infectious, contacting and monitoring close contacts of the patients, working with local healthcare facilities to monitor healthcare workers who may have been exposed. Additionally, we continue to be in constant communication with the Centers for Disease Control and Prevention, the California Department of Public Health, and other state partners, local hospital emergency departments, urgent care centers, and local providers to obtain and provide the most updated guidance regarding COVID-19. At this time, health officials are not recommending the closures of schools or other public facilities, and if that changes, we will provide further instruction. However, like the mayor said, we're encouraging all to prepare, not panic. All communities can take measures to reduce the spread of COVID-19. Everyone has a role to play in getting ready and staying healthy. So again, to reiterate, our community should continue to follow the general health practices. We can't emphasize them enough because they are so important. Wash your hands with soap and water often for at least 20 seconds. That's the birthday song twice. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your cough or sneeze with a tissue and then throw the tissue in the trash. Clean and disinfect frequently touched surfaces and objects. Stay home if you're sick. And if you have underlying health conditions or are an older adult, consider avoiding large gatherings for the time being. If you have symptoms such as coughing, fever, or difficulty breathing, please call rather than visit, if you're able, your healthcare provider immediately to receive further instructions. It's also important to make arrangements if you or a family member should need to stay home. So periodically check your regular prescription drugs to ensure you have a continuous supply in your home, have non-prescription drugs and other health supplies on hand, and talk with your family members and loved ones about how they would be cared for or how you would be able to care for them in your home if necessary. Thank you.
The next individual I'd like to bring up is Deputy Fire Chief Matt Graniason.
Thank you. To help prepare Long Beach, Acting City Manager Tom Modica activated our all-hazard incident management team on March 5th, 2020. The following day, the Joint Information Center was activated to provide the community as well as the media the information up to the date and up to the hour as soon as we got it. We have multiple city departments working together around the clock to monitor the situation. We are in close coordination with our local, state, and federal partners, and we share updated information, coordinate resource, and ensure the continuity of the regular city operations. We are also working collaboratively with health officials to implement enhanced health information, enhance health and safety measures to limit the spread of COVID-19. We encourage everyone to stay informed. Our city communicates regularly and often. Their communication team is staffed with the Joint Information Center and is continuously sharing information as it becomes available. For local and up-to-the-date information, please visit the website, longbeach.gov/COVID-19, and follow us on your socials, Facebook, Twitter, Instagram, and YouTube. The Long Beach Health Department information line can be contacted Monday through Friday from 8 a.m. to 5 p.m. That number is area code 562-570-INFO. Once again, that's 562-570 info. Thank you.
We're going to answer a couple questions, and then I'm going to also, at the end, do a couple comments in Spanish. If there is anyone here that needs anything in Spanish, we'll do that after a couple questions. And we also have with us our directors of our port and airport, our safety officials. So if there's any questions that relates to those, they can answer those questions. Are there any questions?
Can you individuals were tested after they went to the hospital or those symptoms occurred?
So usually, it's a process. They have to be evaluated first and determine if they're appropriate for testing. And at that point, it can take anywhere from about 24 to 48 hours to receive the results once we collect the specimens.
And were they all from the same family or are these separate individuals?
So there's 2 people in one household and then another individual.
Dr. Davis, there's a triage tent outside of the ER at Long Beach Memorial or Medical Center. Did the 3 patients go through that process, or where were they screened?
So I'm not aware if they went through the tent or not.
Earlier today, the county said there were 17 cases in the county. With your 3 cases, where does that put us in terms of the county now? Is it still 17, or is it more than that?
So I believe it would be more, and we'll be updating our website. So probably by tomorrow, it'll have an up-to-date.
It's on top of those cases.
Right. It's on top of the LA County cases. So the Long Beach cases are separate.
Doctor, do we know how long these individuals had been in Long Beach since they returned from their respective trips?
Not very long for the 2 individuals from the cruise ship. A very short amount of time, a little bit longer for the other person.
A few days, a few weeks, or?
Something in there, something in that range. And that'll be part of our investigation, is to go back and actually trace the steps and see where this individual was and
Have
who
they
they...
identified any other individuals who may need to be quarantined at this time, who came into contact with those individuals?
No, that's in process.
And where can people go to get tested, to get that information out if they do feel like they need to be tested?
They should call their doctor. That would be the first step. And then the healthcare provider will go over kind of what puts them at risk and then provide them steps about how to get tested.
Doctor, the triage situation outside of the hospital, do you want to give us a little bit more info on that in terms of people who are curious about it, and how long has that been in place, and how long will it remain in place?
So I'm not familiar with the details of the tent outside Long Beach Memorial, or Long Beach Medical Center. So I'm not sure, like when it was erected. I'm not quite sure I'm assuming they're doing triaging out there, but I'm not quite sure of how they're operationalizing the tent. And there are other hospitals that are also putting tents out. And I know one of the things that would be a good thing to do with the tent is to be able to try to separate people that are having respiratory illness so that we get them in the tent as opposed to letting them go straight into the emergency room.
You mentioned that this was presented.
And I want to just clarify the earlier question, because we got the answer. So earlier today, there was a total of 16 cases across LA County, and so with the addition of the 3 today from Long Beach, we are at 19 as far as we know it at this moment, but of course that number is very fluid and changing rapidly.
Thank you, Mayor.
You said these are presumptive positive results. So are these results going to the CDC, or will the CDC test them separately? How does that all work?
So my understanding is, yes, all the results go to the CDC and they're confirmed. So I'm assuming that they're doing another test to make sure that the results match, which they do for all of the cases in the United States. So this is kind of the process that every...
The same testing, or I think, is there some clarification on if the testing is different?
Yeah, I don't know what they're... No, I don't know if the test is the same or different, or if maybe it's just that they're following a certain protocol, and so they just want to make sure that the results match.
Any other questions?
Yes, hi back here. Since you don't know if those people got in contact with a lot of others in Long Beach, are you concerned about residents here being exposed?
So that will be part of our contact tracing. So that's part of what we do for all communicable diseases. So that's kind of the health department's one of their main functions. So yes, we will be following all the places that this person went and reaching out to all the individuals, doing risk assessments, and then making recommendations based on what we find out when we talk to them, just like we do for other communicable diseases.
And just for the one person, because the other two people did not interact with the public?
We'll do it, we do a routine investigation for every person who's a resident of Long Beach who has a communicable disease.
Yes, sir.
Doctor, are you able to give us the condition of the person who's hospitalized at this point?
That person's in stable condition.
So what about the homeless population? How are they being reached out? And how is this? Because I would assume that when it reaches a homeless person, this is going to become a problem.
We're working very closely with people experiencing homelessness, and with that community. Homeless Services is actually part of the health department in Long Beach, and so we have a very close relationship, and we are putting in plans of just exactly what you said. If there were to be an exposure, what would be the best way to address the situation. And we're also doing a lot of education and outreach and activities along those lines.
You mentioned you had someone from the airport here. Can you give us any information about what's being done at the airport, screening-wise or testing-wise?
Sure. Cynthia, why don't we?
At the screening locations, our airport is cleaning those areas daily and hourly. And the other part of your question, if you don't mind asking that a question.
How are they being screened, and how are these folks being tested if they are coming from, different parts of the country that might have been exposed to this?
So the airport is not doing any medical screening, and I will leave that answer to that question to Ms. Davis, but I will let you know that hourly we are cleaning the actual TSA screening areas. The airport staff is doing that on an hourly basis. And the public areas as well.
Let me just add that any city facility, especially those that have a lot of travel or folks coming in and out, are being cleaned much more often and more aggressively than they were in the past. And I think the airport is not just cleaning all the areas that are seeing baggage and folks coming in and out, but also the holding areas as well as places where people are congregating within the airport space.
That is correct.
And any other final questions? Kelly?
Do you have test kits available here in Long Beach that we're utilizing?
Right now, we do not have test kits at the Long Beach Public Health Lab, but there are test kits in the Orange County Public Health Lab and the Los Angeles County Public Health Lab, and we all the public health labs kind of work together as a network, and we put our samples to whichever one is around. We are expecting to get our test kits by the end of this week.
Okay, we're going to go ahead and just do some just remarks in Spanish, if folks don't mind, so we're going to go ahead and just do that. Estamos acá en la ciudad de Long Beach para hablar del coronavirus. Sabemos que hoy día en la ciudad de Long Beach ahora tenemos tres casos de la coronavirus. De esos tres, ahora en la County de Los Ángeles hay un total de 19 personas que tienen, en el test están positivos. Ese test todavía tiene que tener una confirmación del CDC, del gobierno federal, pero tenemos nuestros primeros 3 casos acá en la ciudad de Long Beach. Estamos diciendo a la comunidad que por favor, si tienen síntomas del coronavirus, que por favor se queden en sus casas, que hablen con su médico o un hospital, y también que por favor se laven las manos para 20 segundos todos los días, cuando salen, cuando están yendo al trabajo, y también por favor que si ellos sepan o si saben que tienen familia o personas que ellos conocen que también están en la comunidad, que también están enfermos, que por favor se queden en la casa. Nuestro departamento de Health, nuestra ciudad, nuestros policías, nuestros bomberos, todos estamos trabajando juntos para poder dar la información a la comunidad. Vamos a continuar a dar información a la comunidad. También sabemos que estamos trabajando con nuestras escuelas, la universidad, estamos trabajando con el gobierno federal, el estado, Governor Newsom y toda la comunidad en el estado para trabajar en esta situación. Y también déjame decir a la comunidad también que yo sé que hay un reporte que hay estudiantes en la Universidad Cal State Long Beach que capaz fueron a un evento donde había gente que tenía este virus, y que sepan por favor la comunidad que esos 10 estudiantes no están conectados a esos 3 casos que tenemos ahora. Es una diferente situación, y esos estudiantes no han tenido un test que es positivo, pero están en la casa cuidándose. Eso es todo por ahora, pero vamos a continuar a poder dar información. Muchas gracias. Thank you guys very much.
All right, so just real quick, we'll finish up with some closing comments. So you can see that behind me here, we are sitting in the incident command post of the All Hazards Incident Management Team that was activated by Acting City Manager Tom Modica. The city has created a unified response, not only here at the Incident Management Team, but also with the Joint Information Center. We continue to keep everyone apprised of developing situations in close discussion and relationships with all of our partners, including the health department. Advise of things that are continuing to develop here in Long Beach by following us at www.longbeach.gov/COVID-19. If the community has any questions, please have them contact us at 562-570-INFO. We'll continue to do our best to keep you informed, continue to keep you up to date. But remember, preparedness starts with you. Each and every one of you have an opportunity to make a difference in preventing the spread of COVID-19 in the city of Long Beach. Please wash your hands, and if you're sick, please stay home. Thank you very much.
So can you talk a little about, we noticed all the supplies that you all gathered in. Can you talk about that?
Absolutely. With regard to all the logistics supplies, you can see that we have the incident command post here that's been established, but we are working on developing these caches of equipment to supply and support our frontline public safety personnel, including police officers, firefighters, and those that come in contact with potentially individuals that may be sick. The point is that you're going to see individuals wearing personal protective equipment, and it might seem odd initially, but we want to stress to you that's not only for your protection, but also our protection. So it's important that you understand that this is a time where we're all taking precautionary measures to keep everyone safe. And I can tell you there's a lot of effort and emphasis going on in developing contingency plans to make sure that we are prepared and ready to respond. If you have any additional questions, we'll be available for some sound bites after the actual press conference, but we do appreciate your time, your commitment to public safety, and making a difference in our community. Thank you.